Platforms like CTV and retail media are helping reshape the health and wellness landscape in a number of different ways. In particular, it allows us to have a deeper level of insight into what our patients and even our physicians are doing in a way that is safe, and more importantly, allows us to understand the spaces and places and moments within their journey that could be more impactful for us as pharmaceutical advertisers and partners to engage them with content and a message that matters.
Melissa, wanted to get your sense of how retail data is changing the agency, client, retailer relationship in healthcare marketing.
It's a small piece of it, but on our side, the more information or the more data that we have that can be actionable or trackable makes our jobs simpler and better and easier, and it makes us smarter. And I think it allows us to understand as well, from a measurement standpoint, how the different channels and tactics that we use can come together in a way that becomes more powerful.
AI is also always promising simpler, better, smarter. Wanted to get your sense of AI's impact, in particular in the way that health brands engage with patients.
So many different things. As I said earlier, I was on an advisory board meeting, and they bring us together, a large healthcare partner, and they bring a number of us together in the industry to talk about hot topics, AI being one of them. The founder of a company called Open Evidence was speaking, which is really a tool that was created and based on AI that allows physicians to utilize and have data from the New England Journal of Medicine and JAMA at their fingertips. So it allows them to actually diagnose and treat and give patients some comfort at a speed that is absolutely unprecedented. But AI is actually used in everything that it is that we do, whether it's search strategies to engaging in the development of content that is relevant for the audiences in which we're looking to speak to even just the way that we capture information or create audiences within our tools to be reflective of the people we're trying to reach.
So where do you see AI having maybe the biggest impact? And is it creative development? Is it media planning, measurement? Or is it across the board?
I think it's 100% across the board, and the more that we embrace it, the faster we'll be able to move, which is funny because when you work in healthcare for as long as I have, we don't always talk about speed, but now it's a hot topic within our industry, and the reality is that the faster that we can move, the faster we can get the right messaging in front of patients and information in front of patients and physicians, the faster they can start to feel better. Or I always say, feel in control of something they don't have control over. So the speed piece of all of it will also allow us to even reach patients before they're even on drug, like clinical trial recruitment, things that actually are the first step in terms of drug development. Being able to utilize AI for good to help us do things like that is incredibly promising.
Personalization is kind of the underlying theme of that last hot topic we discussed. Wanted to see what role you think data and personalization are playing in the future of health advertising. There's, again, so many thickets to navigate there. What's your sense?
I think personalization is critical for us to ensure that we are speaking to patients and physicians in a way that matters to them. Time is spread so thin these days, and consumers are used to now receiving messages that are relevant for them. It's the ones that they're more attuned to. It's the ones that are more measurable in terms of the actions that they can take. Is going to be even more critical now than ever, even though we're in this kind of tumultuous time within our industry where I said to my leaders, buckle up, it's going to be a roller coaster, but we have to stay super close together in order to do so. And our ability to use personalization at scale will only help us, especially in certain therapeutic areas that are a little bit more finite, like rare disease, where we're talking about patient populations that are super small. And when they're seen, it makes a tremendous difference in terms of positive outcomes.
That roller coaster feeling is definitely, carries with it some excitement. With that in mind, wanted to see what trends, in healthcare advertising you're most excited about right now.
Gosh, there's a few different things. As I said earlier, when we talk about tools for physicians, anything that allows a doctor to spend more meaningful time with their patients, I think is absolutely critical. I think when we talk about point of care, like what does that look like in the near future and in the, 1 year, 2 year, 5 years. But more importantly, I think what's really interesting is we think about the future face of physicians and patients. They're going to be more informed than ever. Things are going to be changing. The access is completely different. People are getting diagnosed faster, as I said earlier, but they're also inundated with more information. So how are we using all of these tools to help make it simpler and easier for people to understand and make positive decisions in a world that could also be overwhelming?